Welcome to Richard and Greg, a channel dedicated to discussion, debate and argument on a whole array of topics. Today, Greg and Richard discuss the latest coronavirus figures and ponder how accurate governments are when they quote to their electorate the dates for peak infection rates. Let's take a listen. Welcome to Richard and Greg. The date is Saturday, the 4th of April 2020, and the time 19:26 GMT plus 1. The coronavirus figures are even worse again today, almost across every country that is currently being reported. We thought that in light of this, we would have a conversation with Controversially Greg and focus on those parts of the world who are now beginning to declare that they think next week or the week after will be the zenith of the virus as far as they are concerned. And we ask, Controversially Greg, whether he thinks their assessment is accurate and on what basis they are able to make such an announcement. The United Kingdom and New York being two such places. So Greg, good evening.
Good evening. And it's been lovely weather here, and it is interesting to note that people are starting to take this virus seriously and were not plundering around the countryside, breaking their social distancing.
Well, that is good news indeed. So let's talk about, perhaps give us the top 5 countries' figures briefly, Greg, so we've got an idea of what's happened. And then let's talk about both Boris Johnson declaring next week or the week after being the peak, as they envisage it, and also New York claiming also that next week we'll see the peak, which is why the governor there has been, for the want of a better description, screaming for more ventilators.
Well, let's look at the global figure. We started out a week ago, I said that we would reach 1 million cases by the weekend and that we would reach 50,000 deaths in Britain by the weekend. Well, it's Saturday. We have now reached 1,182,398 cases of coronavirus. We have somewhere in the region of just under 250,000 people who are reputed to have recovered. So we're getting very close to having 1 million active coronavirus cases. Deaths, we have reached 63,913. So we've actually 14,000 ahead of that which we had predicted. We were underestimating. But be minded, we have a huge degree of skepticism when it comes to these figures, and the British government authorities were proving to be relatively sane in their information gathering and distribution. However, today they've admitted that they only count deaths in hospital of people who have been proven coronavirus, as opposed to people who may have been corona and have died of similar things. And also in one nursing home alone in Glasgow, 13 elderly patients died of what was almost definitely coronavirus. However, those people were not recorded as corona deaths. Now, how many people in how many homes have not been recorded? So Britain's figure of 708 deaths for the day and 4,313 deaths so far is clearly, staggeringly underestimating it. That said, America has had 300,000 people, 300,720 to be precise, recorded cases. 8,162 people have died. 758 died today. And that is only today up until the close of the figures. My figures are at 1930 hours. So there is still time to go for more deaths. Spain has reached the staggering total of 11,744 deaths. Italy, the figure of 15,363. France, 7,560. And we have every reason to believe that China, quoting 3,326 and only 4 new cases, is utter, unadulterated nonsense. It just doesn't stack with figures around the world. We also need to look at the number of total tests done. America has done on over 300,000 people, 350 million people, 1,502 tests. Well, there's an awful lot of other people haven't been tested who have probably died.
Sorry, Greg, you said 1,500 tests, but you've already...
1,500,000.
That's what I thought, yeah.
Sorry, mea culpa. I'm juggling with my screen because they're adding columns to it continuously just to confuse me. And I'm a simple soul. America currently has 4,540 tests per million population. It has 25 per million deaths. Meanwhile, Spain and Italy have around 250 deaths per million. So these figures are clearly fairly all over the place. It depends how each nation, each region counts the cases. I don't think we're getting anything like an accurate picture out of it. And it is interesting to note the day before yesterday in our last podcast, you quoted Dr. Fauci.
Yes.
Fauci, is that? Dr. Fauci. What you didn't quote was his statement that modelling tells us nothing, which perhaps he'd like to point that out when it comes to meteorology, to all forms of medicine, to economics, to climate change fanatics, anybody. Modelling tells us nothing. He is the official spokesman for the United States of America. I'm inclined to agree with him. However, that hasn't stopped the American government and New York particularly stating that it's going to be another 2 weeks before they reach their peak. That's based on modelling. So treat it with a pinch of salt. Much the same as the British government saying that we will be reaching the peak in a couple of weeks' time. Well, if it's some sort of accurate modelling, you don't talk of a couple of weeks. You talk of on a given date, because that's what the model is telling you. It also says in this model that we reach a peak then. What is a peak? There are big areas that could well be defined as a summit plateau when you talk of peaks. Are we going to reach a peak, in other words, the maximum number that we are capable of treating and call that the peak, and then continue treating that number for a week, a day, a month, or till the end of the year? These are just guesses being sucked out of somebody's thumb as far as I'm concerned. I will see this and believe it when it happens. Until then, I am going to stick with my figure that there is a potential for 1 to 2 million deaths in Britain and 6 to 10 million deaths in America. We already have a nagging suspicion that there have been 21 million deaths in China that have not been reported, as shown by their cancellation of utterly essential mobile telephone contracts. We are just hoping for the best. Don't for a moment think I take any pleasure in the fact that the figures appear to be completely barking mad, and they're keeping a lot of people in work counting things and juggling figures, but they also seem to be an exercise in how to lie with statistics. Everybody comes up with a new thing that they can add in, yet another column of figures that are largely, it would seem, inaccurate. So 10 pieces of inaccurate information is no better than 5.
Well, Greg, you know that when faced with a crisis, an administration have one of 3 options. The first is to over-exaggerate the potential or the damage in the hope and view that if it's not achieved, they can claim a victory over it. The second is to downplay it in order to avoid panic, because if it's significantly worse than they think it's going to be, or they're relating it to be, they want at least some time to make preparation for that panic. And the third, of course, is to be blatantly honest, which generally means they don't know. And no government likes to admit that they don't know something. So
nobody on this planet knows what's going to happen with this virus. We don't understand it. We don't yet have a cure, a vaccination for the common cold, and we've been looking for that for rather a long time. All that we do with the flu vaccination is we give a mix of 3 or 4 of the most recent varieties of flu at the same time. And that is what the flu vaccination is, and it's a very good vaccination. But it doesn't deal with what is effectively a super virus like the coronavirus strain. Coronavirus has had several pops at humanity, with SARS, with N1H1 or whatever it was, bird flu, and with MERS, Middle East Respiratory Syndrome. And that word syndrome at the end tells you everything you need to know. Syndrome is medical speak for haven't got a clue. This one, COVID-19, is a part of the branch of SARS variations, it would appear, and we don't know what they are, how they work, or what stops them working. We are at least a year away from any possibility of a reliable vaccination. We may be 50 years away from it, but we are at least a year away from it. We can take immense risks and not have it clinically trialed properly, and we can bring it into use prior to that, but that could give rise to a situation that is even worse, just the same as over-prescribing of antibiotics has now left us with a strain of tuberculosis that does not respond to antibiotics. We have 2 schools of thought. There's a very large school of thought that if you are given a course of antibiotics, you must complete the course. There is another school of medical thought that says once the antibiotic has worked, stop taking them, both of which have sound logic behind them, but they're totally opposed to each other. We are fumbling around in the dark. We are very fortunate that we have some drugs that, for reasons we don't quite understand, work with some things. But stop and think for a moment. Aspirin. If aspirin was produced today, it would not pass muster to go onto the market with the FDA in America or with our health checking system in Britain, because the manufacturers, who were primarily Park Davis, cannot define how it works. Yeah, it works, it's brilliant, but they can't tell you how it works. So they wouldn't be allowed to market it today.
Well, Greg, that's fascinating. Now, we're going to have just a short discussion today. So before we go, anything you wish to add?
Good luck, because luck is going to be what saves us. We will, without a doubt, save ourselves to an extent by obeying every regulation put out by our government and by seeking to silence any idiot who wishes to criticize our government, because it is our government that will be doing the heavy lifting on our behalf. We don't know enough to be able to criticize them, so we must go along with our government. For any opposition to open its mouth on this subject and bring doubt to the people is totally irresponsible.
Greg, thank you so much.
Indeed, we shall meet again.
Thank you so much for listening, and we hope you enjoyed that discussion. If you wish to help support this channel, we've placed various Amazon links in the description box below, all of which are self-explanatory, and any purchases from which we shall receive a small commission to help grow the channel further. Meanwhile, please do not forget to subscribe and press the bell sign so that you're notified of any future videos as and when they are published. In addition, we have 2 complementary channels, the first Illuminati Silver and the second Trump for President 2020. And if either of these are of interest to you, then kindly go over to those likewise and subscribe. Until next time.